talking with Paul Farmer at the Clinton Global Initiative. Paul, why was it necessary for the Partners in Health to put out a petition asking the United Nations to focus on poverty at this global health meeting?
Well, we basically, as Partners in Health or a lot of our partner organizations, we've been saying, hey, focus on poverty for 25 years. So this is nothing new from us. And we're just pointing out the obvious links between the non-communicable diseases and poverty, just as we try to do that, talking about communicable diseases like cholera or AIDS or tuberculosis. And it's very difficult to do because, I'm a subspecialist physician. I know how to take care of someone who has cholera, but really it's important to prevent cholera. The same around many malignancies. I know how to treat some malignancies, but it's a lot better to prevent them. And we have more preventives for many of the non-communicable diseases. We have better preventives and diagnostics and therapeutics than we did 25 years ago, or even 10 years ago at the last UN General Assembly, where health matters were discussed formally. So we're pushing forward an agenda that isn't new, but some of the tools we have to fight non-communicable diseases and other afflictions of the poor are new, and we need to get them out there.
Well, and you're also written a lot about, and of course you talk about the social and political causes of illness. Non-communicable diseases have a lot of powerful interests driving them, between food, beverage, tobacco. You could even say the drug industry has some interests in promoting some things that aren't about improving health. And so I guess I'm wondering, was that also part of why the initiative was focused on poverty, that you want to make sure the UN is not subject too much to commercial influence to water things down?
Exactly. That's another part of it is, this is supposed to be our chance to come together as including activists, patients, people affected by certain problems, their providers, policymakers. And yes, we have private sector partners too in the industries you mentioned. We've got to make sure, though, that we focus on the burden of disease, on people who are most vulnerable, and on deploying the tools that we have to fight these problems. And that's not going to be, again, anything other than a fight. It's going to be a lot of struggle to make that happen.
Great. Thanks for your time.
Thank you, Tom. Good to see you again.
See ya.